Dave, thank you. When it comes to the coronavirus, more people are in the hospital with it than ever before. New data is showing that Michigan's COVID-19 hospitalizations have reached a new high.
Yeah, the state released that new data just yesterday. It shows close to 5,000 patients being treated across the state, putting a strain on local hospitals that are already being pushed to the brink. And state health officials are also saying the majority of the COVID patients are unvaccinated.
The news comes as more and more people are getting infected with the virus. Over the last 2 days, there have been more than 15,000 new cases. That averages out to about 7,700 cases per day. And because of this surge, state officials are responding. They've announced a plan to hopefully help flatten the curve.
13 on your side's Joshua Vincent joins us from Medical Mile with more on all of this. Josh, good morning to you.
Hey, good morning, Jay and Meredith. Yeah, as Michigan hospitals treat the highest number of COVID-19 patients during the pandemic, Republicans unveiled a $1.2 billion plan aimed at easing the surge. Now, there are three main parts to this plan, which include strengthening hospitals, expanding COVID-19 treatment, and keeping students healthy and schools open. Now, the biggest part of the plan calls for spending $667 million on continued COVID-19 testing initiatives. Of that amount, $300 million would go to schools for testing students and staff, and $267 million would continue funding community testing clinics, and $100 million would help businesses test employees. Now, the final part of the plan includes $224 million on speeding up access to COVID-19 treatments for medicine and new pills coming to the market. Republicans say the treatments can reduce the risk of hospitalizations and death by 85%, but delivery of the medicines get bottlenecked at hospitals facing staffing shortages. Now, this plan is still very much so in its beginning stages, so it could be months before the money is allocated. It must get passed through the committee first, and then that's when it'll head to the House and the Senate for them to pick up for a possible vote. As for now, reporting live here at Medical Mile, Joshua Vincent, 13 on your side.